can a poor gum health or a gum disease, can it lead to diabetes? Because this is a concern expressed by many of our patients because usually dental health is a very ignored subject. And then, but when it comes to diabetes, it is something of really of concern to many of our patients, the blood sugar level and how healthy their blood level. So is there any correlation between these two is what we look into this particular video. Hello all, this is Dr. Arun from Pearls Dentistry, running a dental centers at Chennai, Raja and Namalipuram since the year 2001. If you have not subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We have a whole bunch of videos coming out on dental health and awareness. Now let's look at these two aspects, right? Our blood sugar level and our gum disease. So usually higher blood sugar level is commonly caused by, there are two different factors. Of the many factors, the two commonest factors is either there is less of insulin production, our body's resistance to insulin is also high, or it can be a combination of both. Of course, there are a lot of other factors like extra pancreatic cancers because of causes like because of hormonal disturbances can also cause this excessive blood sugar levels in our blood, but these are the most commonest causes. So when it comes to gum issues, we have often noticed that a patient who are having a controlled blood sugar levels usually have a very good gingival health, or they are able to maintain their gum health better. Alternatively, patients with an excessive blood sugar level most often will have a very poor gum health. So there is a correlation. Two, what is happening there? Because of this poor gum health or poor gum disease, there's a lot of bacteria there. This bacteria causes toxins. These toxins can dispose through our bloodstream, can cause a focal infection in another area. So now any infection that's going to be present can be a source from the mouth also, is going to increase the sugar demands on our body, which is going to make to control our blood sugar levels very, very difficult. Another commonest aspect is it's a sort of a vicious cycle. So when our gum is inflamed, there's a lot of inflammation of the gums, there's a lot of pus discharge can happen from the gum. In those patients, we have often seen their blood sugar level is almost always impossible to control, and vice versa. So helping to control the blood sugar level will also increase the gum health, and also improving the gum health will help to control the blood sugar. It's a sort of a cycle. So when our sugar levels are not controlled, our gum becomes poorer. When gums become poorer, our sugar levels keep further increasing. So it's a sort of a cycle. To break this cycle, of course, as we take steps to ensure that we take proper diabetic medications, we ensure that we do our exercise, do diet control, it's also essential that we take steps to improve our gum health. A simple cleanup, a laser curettage will go a long way to remove the bacterial load from our mouth. So this removal of the bacterial load from the mouth will help to control the blood sugar better. And because when a blood sugar is high, we can't do extensive surgical procedures in our mouth. So a simple procedures will help to reduce the bacterial load. Reducing the bacterial load will control the blood sugars better. And once we control the blood sugar, we'll be able to take more extensive work to improve our gum health. And when we improve the gum health, it has been shown that it helps to control the blood sugar keep the blood sugar stable for a very long periods of time. So hope this addresses this question of the correlation between diabetes and the gum health. If there are any questions, please do ask in the comment section below. Until next time, this is Dr. Arun from Pearls Dentistry. Bye bye and thank you.